Welcome to This Explainer. Today, we're diving into something absolutely fascinating, a bold, truly world-changing vision of how artificial intelligence is on track to completely revolutionize medicine by the year 2035. We're not just talking about AI drafting emails for your doctor. We are looking at a future where this technology fundamentally alters humanity's entire relationship with longevity and disease. So picture this. You get this weird red bump on your hand. You take a quick picture, upload it to an AI, and ask, hey, is this a wart? The AI instantly recognizes the pattern and asks you, did you happen to walk through a pricker bush recently? And, well, it turns out you actually had. You just completely forgot. This tiny, seemingly low-stakes, everyday interaction, that's our entry point into what is going to be a massive societal transformation. All right, let's jump right into Section 1, your personal health advisor. You know how frustrating healthcare can be today, right? You might get some blood work back and be told you have neutropenia. Okay, sounds scary, but it literally just means you have low white blood cells. It's just a description of the problem, not an actual diagnosis explaining why it's happening. The real answers are usually buried somewhere in endless stacks of your medical paperwork. But AI has this incredibly unique ability to instantly read, digest, and connect the dots across all those scattered pages to find the actual root cause. Think of it almost like having a world-class medical advisor just living in your pocket, working constantly in the background of your life. It doesn't sit around waiting for you to get sick. It ingests your daily sleep data, your diet, your routine blood tests, the whole shebang all at once. And then, before you even feel a little bit under the weather, it flags early anomalies and tells you exactly which specialist you need to see to prevent it from becoming a real issue. Because of this, we're seeing everyday patients transform from being passive participants in their health into truly empowered advocates. I mean, the ultimate prompt people want to give an AI is super simple. Help me flourish. By uploading all those complex records and getting clear, simple answers about confusing symptoms, patients are suddenly equipped to demand better care and actually advocate for their own long-term health. Moving right along to Section 2, inside the AI clinic. Okay, so this is kind of wild. Despite all the fears that the medical community would totally reject this tech, doctors are already secretly using it at home to handle massive amounts of patient data. When tech developers visit hospitals, doctors actually pull them aside quietly and confess that they use it constantly. They're practically begging the developers, saying, please make a secure, HIPAA-compliant version so we don't have to hide this and can just use it openly at work. But obviously, there's a really important balance we have to strike here. If you come back from a hike with a nasty case of poison oak, you're probably perfectly happy letting an AI instantly prescribe you a rash cream. But what if you have strange symptoms and an AI flags potential cancer? No way. In that moment, you absolutely want a human doctor. You want their empathy, you want their physical presence in the room, and you want that deep human trust that only a real person can provide when you're facing a terrifying life or death situation. Now, we also have to highlight a massive, completely unforeseen risk here. As this technology advances at warp speed, people aren't just using it to check rashes anymore. They're starting to use it as a personal life coach or even a therapist. When millions of people suddenly start relying on a 3-year-old technology for deep emotional support and human connection, well, it creates a highly unpredictable shift in societal mental health. And frankly, developers are only just beginning to understand the implications of that. Which brings us to Section 3, supercharging biological research. Let's zoom out a bit. How do we actually extend our health span and cut through the massive knot of age-related degradation? Well, a huge area of investment right now is something called partial reprogramming. Instead of just playing whack-a-mole with individual diseases as we get older, the goal is to introduce proteins that literally rewind a cell's age back to a slightly younger state. It carefully avoids reverting them completely into stem cells because, that would basically turn you into a puddle of goo, but it fundamentally keeps your body running healthier for much, much longer. The thing is, human biology is just ridiculously complex. It's so complex that we honestly might not have the raw human brain power to untangle it all ourselves. But AI completely changes the game. If we build an intelligence that's, say, 1,000,000 times smarter than us, it can do all that heavy lifting. It can map out the crazy complex physics of our biology and then simply translate it into clear answers for researchers. It's going to accelerate the rate of medical discovery in ways we literally can't even fathom yet. And that leads us perfectly into our final section, Section 4, the 2035 Health Horizon. All right, get ready for this staggering prediction. Experts are currently anticipating that by the year 2035, AI will give us the insights we need to treat or mitigate most major diseases. 2035, that is barely a decade away. It's a timeframe that is going to entirely redefine how we view aging and what it actually means to live a complete, healthy human life. The velocity of this revolution is, frankly, just mind-blowing. Think about it. Just 3 years ago, AI was basically a fun novelty to help you write essays or a basic Google replacement. Today, it's actively diagnosing minor ailments and decoding huge stacks of complicated clinic paperwork. In just 10 years, the baseline standard of care for literally everyone could surpass the absolute best, most expensive concierge care available today. And then, by 2035, we cross into an era where major diseases are effectively managed by AI insights. So, let's wrap this explainer up with a thought. If we truly manage to cut through the knot of aging, and this incredible tool ends up granting you a significantly longer, dramatically healthier span of life, what are you going to do with those extra 10 years? It's a pretty amazing thing to think about. Thanks so much for joining us for this explainer, and we will see you in the next one.